Welcome to Almost Here, Round the Corner Future Technology podcast with Richard Jacobs. Future technologies poised to transform our lives for better or worse are the focus of this podcast. Almost here means these technologies are now here and starting to be used, or just around the corner, from Bitcoin to artificial intelligence, 3D printing, blockchain, virtual reality, and more.
Hello, this is Richard Jacobs with the Future Tech and Future Tech Health podcast. My guest today is Hasan Celiker, the founder and chief executive officer of Xeno Biosciences. So, Hasan, how are you doing?
Good, Richard. How are you? Thanks for having me.
Yeah. So, Xeno Biosciences sounds like Xeno sounds like foreign or alien. What's the premise of the company?
Yeah, so it's related to the microbiome. And the idea of the name is that Xeno means guest or foreign, and that's related to the guests that we have in our guts, and also kind of related to our product, the drug that we're producing, because it's oxygen, and Xeno contains all letters that are in oxygen essentially. So that was the premise of the name. But yeah, so I can tell you a little bit about what we're trying to do.
Go ahead. Sure.
So what we're trying to do is we're developing an oral pill to treat obesity, and it mimics the changes in the gut microbiota that occur after gastric bypass surgery. And we believe that's the main reason why the surgery causes weight loss. There's this substantial shift in the structure of the microbes that live in your gut. And there's this, just to give you a bit of a background on the surgery. So this is gastric bypass surgery. It's a weight loss surgery. It's a profoundly effective intervention, and it's actually the most effective treatment that we have for morbid obesity currently. And it causes profound weight loss, 30% on average, and sustained over many decades. And it has all these huge effects on other comorbidities of obesity, like diabetes, fatty liver disease, and so forth. And for a long time, people have thought that the surgery worked because it made your stomach smaller, and maybe there's it caused some malabsorption because there's a bypass of the small bowel. And but we now know that those are not the reasons why the surgery works at all. And just to clarify, the surgery essentially involves bypassing the stomach and connecting the esophagus directly to the small intestine, and then bypassing the stomach and a portion of the small bowel, and then it has all these effects. And as I mentioned, there was this idea in the past that you can't fit in as much food into the stomach because now it's smaller, or there is malabsorption because of the bypass of the small bowel. Well, we now know that those are not the reasons why the surgery works, and we are working on what we believe is the main reason why the surgery causes weight loss, which is this shift in the microbiome.
Well, how could you digest with no stomach? I thought that the stomach acids are necessary to start to break down food so it's ready to go into the small intestine to be digested further.
Right. Yeah. So actually, after the surgery, this has been measured in animals and humans. The digestion happens normally in the sense that there is no significant caloric malabsorption after the surgery. You would think that there would be because you're bypassing the stomach, but actually most of the digestion in our guts happens in the small intestine. The stomach holds the food. It has acid in it, and then it initiates the breakdown a little bit at the beginning, but it's not the main. That's not where the main digestion happens. It's in the small intestine.
So what happens to the microbiome? How does it change? Is there like a big die-off, or a complete replacement of the species that are there with new ones?
So what happens is, this happens in humans and animals. So you can do the surgery on animals, and they do lose weight and have the same shift in the microbiome. But overall, what happens is there's this shift towards more aerobic bacteria in the gut. So normally in our guts, the bacteria that live in there that are anaerobic, meaning that they don't use oxygen to generate energy, so they don't respire, and they don't grow in the presence of oxygen. But after the surgery, there's this very large shift, substantial shift towards more of these aerobic bacteria, or what are called facultative anaerobes, in the gut that are usually less than 1% of the total population. And now after the surgery, they reach up to 10, 20%. And that's the shift that happens that we can observe with sequencing. There could be other things going on, but the manifestation of the shift is the change in the microbiome. Is that there's this the bacterial populations, you can see this aerobic bloom of bacteria. And yeah, so I
So
just,
how do one thing I've noticed is the people that get gastric bypass surgery, they literally can't eat the same bolus of food that they were. They're eating a lot less.
right.
How do the new bacteria metabolize the food versus the old bacteria? What's the difference there?
Right. So I should also, before getting to that, I should also mention, tying it back to the surgery. Why does the aerobic bacteria increase? And we believe that's because the surgery disrupts the gas homeostasis in the GI tract, meaning that we normally swallow a lot of air per day into our stomachs just by during drinking or eating. That's like liters of air per day. And then that air, obviously contains enormous amounts of oxygen in it. And normally the stomach prevents any of that air from going into the small intestine because it's like a large bag. It has a valve at the end, pylorus, and we have all these mechanisms like belching reflex or regurgitation, passive reflux, by which the air that gets into the stomach is eructated. But after the surgery, now you have connected your small intestine directly to the esophagus. There's no stomach, and that air gets infused into the small intestine directly, and then transits very rapidly actually to the colon. And since that air contains a lot of oxygen in it, enormous amounts, and the oxygen is poorly soluble, it transits to the colon. And then we believe that that's what drives the shift in the microbiome. And going back to the idea of eating small amounts, yes. So after the surgery, patients have to eat smaller amounts, but they eat more frequently. So their meal size is smaller, but they they eat more frequently throughout the day. And after the surgery, post-operatively, very acutely, they're eating. Food intake goes down a lot, but then it actually goes back up to, after 6 or 12 months or so, to a BMI matched control, in the sense that they eat the same amount of food that, a person with their BMI would be eating. It's just that there's this nuisance of the surgery that they have to eat smaller amounts, but more frequently.
Well, that'll be a million times better if you didn't have to have this surgery and you could just change over the microbiome profile. So what you're doing makes a lot of sense. So why do I guess there's a different environment, so that's why there's different microbes that flourish, and the old ones are I guess unnaturally selected out is what happens, right?
Yeah. So we believe it's essentially a selective force that the oxygen in there is enriching the bacteria that are aerobic bacteria, and you have to have that selective force to maintain that in the gut. So if you, for instance, you can actually take the microbiota from animals who have had the surgery or humans, right? So you can take stool samples from these people and then transplant those microbes into animals that did not have the surgery, and then you can transfer the weight loss phenotype by just doing that. But the thing is, you can measure what happens to the microbiome after one transplant, for instance, right? So you transplant the gastric bypass microbiome into an animal, and then look what happens over time. You can see that it reverts back to a normal state, anaerobic state, because there's no selective force that's maintaining it, just after the transplant. So yeah, going back to the point that you have to have that selective force, that different environment, to have this change.
Well, I don't know, maybe it's silly, but what if the person had air pills, like time-release pills that just contain a little bit of air in them, or oxygen in them? They got through the stomach, and then they release their oxygen into the small intestine part. Would that work, or is that ridiculous?
Yeah, but, that's the thing that we thought about. But the thing is, we're releasing a big amount of air, oxygen in there. So it's like we're planning to release about 30 to 40 mils of air with our pill. But it's not air. It's a solid API that with just one pill you can have that. But you wouldn't be able to do that with air pills. The other thing is that that would require hundreds of pills essentially for you to take. The other problem is that the pills, if they just have air in them, they float in the stomach and don't go into the small intestine. It's because of the same idea that the air stays in the stomach, right? They wouldn't be able to reliably go into the small intestine, if you just had empty pills, essentially.
So how do you describe your solution? Like, how does it work? Without giving away proprietary info, but how does your solution work?
Right. So our solution is that we have a material that when you put it in water, it releases oxygen gas. It's a solid, material API, active pharmaceutical ingredient, and we coat it with functional coatings so that when you take it, it bypasses the stomach and it doesn't release in the stomach, and it goes into your small intestine, and in the distal small intestine, last part of the small intestine, it releases oxygen gas because the functional coatings dissolve and let the API, the active ingredient, to react with water and release oxygen, and then have this change in the microbiome after that, because there's more oxygen in there now in the proximal colon.
Interesting. So what have you observed? Are you testing this in animal models? Do you see a slow changeover over time to a new bacterial profile, or like what have you observed?
Right. So we've actually, when we started out this project, we were thinking that this could be a supplement, just because the ingredients we use are safe. But then we decided to go the drug route. But in any case, at that time, we have some people have tried this. Actually, the pills, including me, I was the first one trying these. And and while the subjects were trying them, we measured weight, we measured all sorts of different things, and also the microbiota, so before and after, or before and during dosing, I should say. And we did indeed see changes in the microbiota similar to what happens after gastric bypass with these pills, and also a lot of weight loss in these people who have taken it, especially if they were obese to begin with. And the other thing that we observed is that they had this metallic taste in their mouths, which prompted us to look into whether they're in ketosis, essentially, because apparently this is a thing that happens after the surgery as well. And then we measured whether they were in ketosis during dosing, and indeed they were, even though their food intake was not very significantly changed, as self-reported by them. So overall,
that's interesting. Why would they be in ketosis? What changed metabolically?
So we don't know, but the thing is, what we do know is that for the surgery is that it induces a change in metabolism, like drastic change physiologically, because it is what the surgery does is actually changes how the brain dictates the body weight is maintained. So the brain is actually controlling how much you weigh, and that's one of the reasons why it's so hard to lose weight, because if you try to voluntarily restrict your calories, what happens is that the brain senses this and then induces hunger, decreases metabolic rate. So it's it becomes very hard to lose that weight because the brain wants to be at a certain weight. And what happens after the surgery is, even though these patients are not eating that much and they're losing enormous amounts of weight, they don't feel hungry, right? And that's one of the indications suggesting that there's something very physiological going on, and the brain is now actually actively trying to lose weight, actively telling the fat mass to go into lipolysis and shed essentially the fat mass, and that induces ketosis if you have a lot of fat that's being dumped. And again, as I mentioned in our experience with the subjects, they were losing weight, and it's reasonable then that you have this ketosis effect as well. But again, we don't know.
Do you
exactly
think that by changing the microbiome, you change the weight set point of the brain?
Exactly. So what, again, we don't know exactly what's going on, but our working theory is that, you shift the microbiome, right, and towards aerobic bacteria, and what happens is there's the immune system and the nervous system lining the colon. There's a lot of nerves, there are a lot of immune cells along the colon. They communicate with each other. There's nerves going from the mucosa of the colon to the spinal cord and then to the brain directly. So there's a direct highway of communication between the colon and the brain. So what we believe is happening is when you shift the microbiome like this, this is being sensed by the immune system and the nervous system, and it goes to the brain, and it may be functioning like a kind of like a vaccine, we think, and putting the immune system on alert maybe, and then the signal goes to the brain, and the brain initiates all these programs as to dump the fat mass, and do all sorts of things. So that's our working hypothesis. It is ultimately the brain that's dictating all of this and is the driver of the weight loss after the surgery as well.
Well, it sounds like it's the brain's interaction with the species of microbes that are in the gut.
Yes.
It sounds like there's a communication back and forth between the two, because otherwise, why would the brain just change its set point? They must be be influencing our regular brain, mammalian brain somehow, the signals.
Yes. Yeah, exactly. So what we think might be happening is that, these types of bacteria that increase after the surgery, the aerobic bacteria, they look very similar to the bacteria that usually cause enteric infections. Okay, so, but they are commensals, the ones that increase after the surgery that in your gut, like these are bacteria like E. coli and that sort of thing. But they look very similar in terms of their, antigen profile. If your immune system, if you look at this, you may think that, this looks very much like an infection, right? But it is not. But nevertheless, once you see that sort of a profile, sort of a sensory profile, it may signal to the brain and, initiate a reaction. Again, as I said, kind of like a vaccine would. So this is, not a real infection, but might mimic one. And the other point on that is actually, if you look at the gut microbiota of hunter-gatherers in traditional societies, or mice that live in the wild, as opposed to the lab mice, or as opposed to humans in our modern environment, right? You see the enrichment of same type of bacteria that happens after gastric bypass. So these aerobic bacteria are more abundant in hunter-gatherers or wild mice, which might, again, this is a hypothesis, but it might be related to what's happening in gastric bypass, in the sense that for millions of years throughout evolution, we may have had this pressure in our guts that, sort of like a chronic subclinical infection type of a thing. It's tolerated by the body, but it has been always there. But now in our modern environments, or in a sterile lab facility, like in that the mice are in, you lose that, and then that might be actually underlying some of the diseases that we see in our modern environment, because we live in much more sterile environments with sanitation.
So have you profiled any patients over time? Looked at their gut bacteria, let's say every day for a month or 3 months, and have you observed the changeover of their gut bacteria? And if so, what have you seen?
Right. So people have only taken this at most for 5 to 6 weeks, but we have looked at during that time at baseline and during the first week of dosing, we have, as I mentioned, sequenced the microbiota from these subjects, and indeed we saw increase in these types of aerobic bacteria that you would see in a gastric bypass. So
right, but have you seen a decrease in other species that are normally there, or a change in the mixture, or like a drastic makeover of the gut? Like what can you say about it?
So we measured relative abundance, so the fractions of the species, and what we saw was starting from about 1% abundance of these types of bacteria, they go up to like 10%, and not much significant. Again, we don't have a lot of data to statistically look at statistically say something about the other types of species, but there wasn't any trend or anything. It's just like these bacteria just increased, and then all the other ones were less. But again, it's a small change if you think about it, because it's like going from in terms of the other types of bacteria, because they go from about 100% to 90%.
Well, yeah, I guess you'll have to study the longer term effects, because someone doing this for 5 or 6 weeks is different from someone doing this for a year or for many years. So how are you going to get to the next step where you can determine that what's going to happen long term?
Yeah, that's gonna happen through formal clinical trials with going to the regulatory approval for a drug application through the FDA. But one thing that we have that's nice is that we know that gastric bypass patients have this microbiome and they live with it lifelong. There's decades of follow-up showing that gastric bypass is actually very safe. The patients live healthier, they live longer. And there's all sorts of improvements in their, comorbidities, as I mentioned, like diabetes, and their cancer rates drop significantly, like 40% decrease in overall cancer rate. Mortality, all-cause mortality drops by a lot, by 50% over time. So the surgery is actually saving lives, and they live with this microbiota in their guts all their lives after that. So that's a good indication that this has very good long-term safety. Just by if you're talking about the microbiome. So that's giving us confidence that this is something important that we should pursue. So
prebiotics, from my understanding, that's essentially food for the bacteria you want to be there. So is there anything you've identified that these new oxygen-loving bacteria would thrive on?
Not something specific, I should say. It's having oxygen is a big deal, and more than any other food substance, because you can convert one molecule of sugar into many molecules of energy if you have oxygen, as opposed to just a few with the anaerobic respiration that the microbes in there usually do. So it's a enormous competitive advantage having oxygen in there, just by if you're growing on the oxygen. The other thing is that the oxygen does is it creates a niche for these bacteria, because most of these anaerobic bacteria don't grow very well in oxygen, so they have to wait until the oxygen is consumed locally by these aerobic bacteria where they are present. So it's Yeah.
So what happened with yourself? Did you take this for a while and then stop, or are you continuing to take it? And what kind of effect has it had on you? Or do you have, again, what kind of other data do you have? What does it show over time? How fast does it act?
Yeah, so it acts pretty rapidly that we've seen so far. There's some, I don't have that much of weight to lose. I'm quite skinny actually. So if you do the surgery on lean people, they don't lose much weight as well because you have to have a certain amount of fat mass to be able to lose anything. But in any case, I lost a few kilograms over a week. But then that's the most the time period that I've taken it. But as I said, other subjects have taken it 5 to 6 weeks. They've seen ranging from 5 to 11.5% weight loss over that period, which is quite substantial. And so in terms of other effects, what we've seen is, as I mentioned, there's this metallic taste, which prompted us to look into ketosis, and there is a mild constipation as one of the side effects, which actually happens after the surgery a lot. So these patients go into have a lot of constipation. So that goes against the idea of malabsorption as well, right? So if you had malabsorption, you would have a lot of diarrhea, but these patients generally suffer from constipation. And some questions that we get: do we get flatulence or not? But again, this is a small amount of gas that we're putting in there. Is not very significant compared to the amount of gas that's already in there. Although the patients, gastric bypass patients, have a lot of flatulence and gurgling sounds, in their bellies all the time because that's air, we believe, that's moving through their guts all the time, which makes sense. Yeah. So that's
Have you thought about, since you've created essentially a pill that releases oxygen into the intestines, what about ones that would release nitrogen? I don't know, to help with surgeries, or is there any other pathways you can use?
So I don't think you mean nitrogen gas, right? You mean like nitrate?
Well, I've heard with some surgeries they'll like fill your stomach with nitrogen gas, just to move things out of the way so you can see. It just came to mind. I just wonder would it be helpful to have a pill that releases nitrogen gas into your intestine, or anything else to affect it in some way, or is it just?
Yeah. So we think it's just the oxygen that's important. Nitrogen gas is inert, and usually when people do surgeries, they usually put in carbon dioxide into the body cavities. Like when you do gastric bypass, they put in carbon dioxide because it can be absorbed relatively fast as opposed to nitrogen or oxygen because it dissolves a lot more in water. So that's why people use carbon dioxide. But again, it's just oxygen that's relevant in our case.
Okay, it just brought it to mind. That's what I was asking. So
yeah, no problem.
Do you see any pushback? I mean, because I would think, unfortunately, gastric bypass surgery probably earns quite a bit of money for
yeah.
for the people that do it. This would be a great way to bypass the bypass, which is funny.
Yeah.
What's your path forward? What do you see as happening over the next few years?
Yeah, so you're right in the sense that, like, if you go to a surgeon right now, or someone related to that field, bariatric surgeon, I mean, they would tell you, even the patients, that the surgery works because you can't eat as much, right? And but that's, as I mentioned, that's not correct scientifically, but that's the mainstream idea that people have why the surgery works. So that's one type of a barrier that that we need to I guess go through. But in terms of moving forward, we're just gonna be collecting data, testing this hypothesis to as much as we can, and hopefully we're planning on being in clinic later next year. So which will be the ultimate test, because we believe in just phase 1 trial, we may be able to have proof of concept, efficacy data to be able to show that this is working. So that's our plan. So just data.
Okay. Well, very good. So what's the best way for our listeners to get in touch?
Well, they can go on our website, and I think there's a contact form there. There's all sorts of other information if you just Google my name in terms of if they want to get in touch with me directly. But other than that, we are open to inquiries of any sort.
Very good. Well, Hasan, thank you for coming on the podcast. I appreciate it.
All right. Thanks for having me. My pleasure.
You have been listening to Almost Here, Around the Corner Future Technology podcast with Richard Jacobs. Subscribe to this podcast, post a review to discover more future technologies that are poised to transform our lives for better or worse, such as Bitcoin, artificial intelligence, 3D printing, blockchain, virtual reality, and more.